Hey guys, what's up? It's Dr. Giles here with Aspire Chiropractic. Now, today I want to talk to you guys about something that I have every single week I see in my office with patients, and I have constant questions about it from patients all the time. And every single chiropractor I know deals with this every single day in their practice, and they deal with it better than anybody else. And it's arthritis, okay? A lot of times it's really misunderstood by patients too, so let's explain it a little bit. Arthritis is essentially an umbrella term referring to two different types of arthritis. You've got inflammatory arthritis and you've got non-inflammatory arthritis. Inflammatory arthritis would be things like rheumatoid arthritis, psoriatic arthritis. These are autoimmune conditions where the body is attacking the cartilage in the joints and causing inflammation, redness, swelling, lots and lots of pain. Now, inflammatory arthritis can also be systemic, and it can cause things like severe fatigue, fever. I've seen patients that have a lot of just systemic inflammation in their skin and in their joints. Now, this type of arthritis is going to need a blood test to be able to determine what's really going on. The other type of arthritis, the most commonly seen arthritis, and the one that I want to talk to you guys about today, is called osteoarthritis. Osteo being bone, arthritis being inflammation in the joints. So bone inflammation in the joints. This is known as the wear and tear arthritis because it happens with age, degeneration, previous injuries, things like severe weight gain and obesity. They cause wear and tear and damage to the joints. Typically, you see it in weight-bearing joints like the knee or the hip or the spine. You also see it very, very commonly in repetitively used and stressed joints like the hands and the feet. But osteoarthritis can occur in any joint in the body. What's happening during osteoarthritis? Now, as you're aging, this cartilage that's lining the joints and making these motions smooth, these articulations smooth, starts to degenerate and wear down. Typically, that's happening with age. That's why you see arthritis so much as people are getting older. It happens a lot with previous injuries or any type of accident that might have happened to the joint to cause it to be misaligned. Picture this hip joint right here. If this hip gets injured and it's out of alignment and it's grinding away on side of this cavity right here, eventually that cartilage is going to wear down. So what do we get? We get thinning of the cartilage, and that causes the bones to then become contact with each other. And we get bone on bone. There's cracks that happen into this little area. And then we start to form something called osteophytes, which is just a fancy term for bone spurs. Those bone spurs are there because they're trying to stabilize the joint now that that smooth motion is no longer there. But what happens is those osteophytes, those bone spurs, cause increased pain and cause increased misalignment in the joint, furthering and progressing the process. Then, as it continues to progress, we start to get inflammation more and more in the joint spaces. And then, as that inflammation increases, you get redness, you get puffiness, you get swelling in the joints. Obviously, you're going to have increased pain. And the final progression of all of this is we're going to get misalignments and malformations. That's a deformation at the bone. So you'll see the head of this femur might start to grind away, or the knee might start to bend out a little bit right here. You'll see a lot of increased bone matter on x-rays in the spine right here in these areas. So what do we do about osteoarthritis? The most important thing you can be doing for osteoarthritis is mobility, mobilizing the joint. Now, it's a little bit of a double-edged sword, right? Because if this material, this cartilage is all worn away and we've got all these osteophytes right there and we're moving the knee and it's a weight bearing, it also has the potential to increase the pain. But trust me, the mobility, moving the joints is what your body is needing. And that's what we do as chiropractors. We're going to go in, we're not going to go in, we're going to adjust you because we can't really go in, but we're going to adjust you. We're going to go to the spot where you're feeling the arthritis, and we're going to make adjustments in that area to make sure the alignment in the joint space is correct and moving smoothly. That mobility actually will help to increase movement in the space, get you feeling a lot better. It'll decrease the pain, it'll decrease the swelling. and it'll actually improve a lot of the range of motion. That's a lot of what we're trying to do as well, is improve the range of motion. How do we do this in our office? Chiropractors, we make the adjustment. Of course, we make the adjustment in the spine. A lot of folks don't realize that we can also make adjustments at the hips, the knees, the feet, the ankles, the shoulders, the elbow, all the joints in the body that are prone to osteoarthritis, we can adjust. We also have in our office decompression therapy. Decompression therapy works great with issues in the spine by tractioning open the spine and relaxing it, putting movement into this space, freeing up a lot of the inflammation in there. And then finally, we have in our office soft wave therapy. Soft wave therapy works amazing. I have seen patients come in with severe knee pain, severe hip pain, and after one treatment with soft wave, they're moving better, the knee's bending, they can lift their hip higher. It focuses on the soft tissues in the joint space. It helps with decreasing the inflammation, it increases capillary refill, and it helps your body produce its own stem cells. If you're feeling any type of severe stiffness, achiness in your joints, your knees, your hips, your spine, your shoulder, your elbow, come on into our office, let us do an exam. We're definitely going to take some x-rays so we can get a really good idea of what's going on in that joint space. And then we're going to put together a customized care plan for you on how we're going to take care of it and help you feel better, get you back to the activities that you enjoy doing, get to living your life as full and as happy and excited as you can. So, Aspire Chiropractic, we're ready to help you when you're ready to be your best, naturally.